Even before the last menstrual period or the time of menopause, women suffer from a variety of symptoms that we would call menopausal symptoms. They include hot flashes, night sweats, vaginal dryness, occasional irritability, irregular menses, all kinds of things that really are strange for the woman who used to have an unencumbered life as it related to her menstrual cycle and as it related to these symptoms. Yet, physicians, nurse practitioners, and other health professionals often withhold treatment because the woman's still having cycles, sometimes regular, sometimes irregular, but still having cycles, so she doesn't qualify as being fully menopausal. Why would a woman who's having a regular cycle begin to have hot flashes and night sweats? Well, it's not all entirely clear, but what is known is that the set point, her internal thermostat, begins to change. It gets corrupted, in fact, in the last year or so by her own production of estrogen, such that when subtle changes in her own estrogen levels fall, they trigger hot flashes and night sweats, something that historically would never have affected her. So how do we intervene to provide some symptomatic relief for that woman who's still menstruating but who's having typical symptoms we associate with the menopausal woman? Well, one approach to this would be to regularize her cycle by the use of combined hormonal contraception. Remember, by regularizing her cycle, providing contraception, we're also giving her back a steady level of estrogen in her own blood, something that, remember, we started out by saying is the subtle decrease that triggers the symptoms. The other way to do it would be to just supplement what is already a relatively normal level of hormones with supplemental hormones. In other words, treat her as if she's menopausal, but even though she's not. This is an approach that developed out of our understanding of the subtle changes that trigger symptoms during the perimenopause, avoiding, if you will, those subtle decreases in estrogen, and knowing when in the menstrual cycle they occur is critical to the use of this approach. It's not that problematical. Get your practitioner to intervene even though he or she knows you're not yet menopausal. There are many different women's health practitioners and professionals of different designations that take care of these problems. You might prefer to address the issue with your primary care doctor, or seek a specialist who happens to be expert on issues of sexual function or menopause or hormone therapy. If you have trouble finding someone to help, contact us at the website listed just below.